Hi, this is Lindsay Felgen. I'm a nursing student at Wilson State College in the Dakota Nursing Program. And today I'll be demonstrating how to withdraw blood, change the dressing, and give medications through central line. So the first thing that I'm going to do is check over my healthcare provider orders, and it looks like we are going to use the port for blood draw for labs today, and then we're going to change the central line dressing since the orders for every 7 days, and it has been 7 days. So we're going to get our supplies and go to the patient's room. So we have our 2 flushes and our empty syringe for the blood draw. We've got our alcohol pads and then our dressing change kit, and we're in the patient's room. We've knocked, and then we're going to perform hand hygiene and verify the patient. So we have Chester chest 71919, Chester chest 71919. Okay, Chester, so today we're going to go ahead and get a blood draw from your central line, and then we're going to go ahead and change the dressing since it's been a week since it's been changed. Okay, do you have any questions? No? All right, so we're going to go ahead and put on our gloves. And we're going to assess the site, make sure that there's no redness, swelling, or tenderness. And Chester said that it feels fine. So we're going to go ahead and get our supplies over here, and we're going to perform the blood draw. And we're going to go ahead and clean the hub for 10 to 15 seconds. Okay, and then we're going to get our saline flush. And we're going to go ahead and hook up here, and we're going to aspirate to check for patency. So we're going to aspirate, or we're going to unclamp it first. And we're going to aspirate and we see blood in the line here, but we're not going to let it in the syringe, and we know that the line is patent then. So we're going to use the push pause method to flush the line. Okay, and then now we're going to leave the syringe on. We're going to withdraw 10 mils of blood. And you can go ahead and clamp our line here. And we're going to discard the syringe into our sharps container. And then we're going to go ahead and get our empty syringe, and we're going to clean, since I let go of the binder, we're going to go ahead and clean that up again for 10 to 15 seconds. Okay, and then we have our empty syringe, and we're just going to touch that, and we're going to unclamp our line, and we're going to withdraw our 10 mils of blood. And we'll clamp the line again, and then we're going to hand this off to our phlebotomist or med tech, and they take that. Then we're going to go ahead and flush the line again. And we're going to unclamp it here, and we're going to use the push pause method again to flush the line here. All right, and I'm going to make sure it's clamped. And we can discard this and clean up our area here. All right, and I'm going to go ahead and remove my gloves, perform hand hygiene, because now we're going to change Chester's dressing. So I've taken off my gloves, we've done hand hygiene, and we're going to go ahead and take off, well, we're going to take off our dressing and open up our kit here. Alright, so Chester, for this, we're just going to lay the head of the bed flat, and I'm going to raise the bed up to a comfortable working level for me here. And so we've done that. We're going to get our patch, and we're going to open that, and we're going to drop it onto our sterile kit here. And so now we have that ready. We're going to go ahead and take off the dressing. And we're going to hold the catheter here to secure it, and just peel the dressing off. and we're going to pull it towards the site. Okay, and then we'll go ahead and take off the antimicrobial patch as well, and we will discard this. And then we're going to tell Chester to make sure to stay still and keep his head turned to the opposite side so that we don't contaminate the area. And I'm going to remove my gloves and perform hand hygiene so that we can work with our sterile kit here. So we have this mask for Chester. We can put this on Chester here. And then we're going to go ahead and grab our sterile gloves. All right, and so we're going to start with our non-dominant hand. And then we can fix that in a minute, and we'll put on the other glove, making sure to grab underneath the cuff. All right, and so we can fix the other hand, and so now we have our sterile gloves on, and we're going to go ahead and grab our sterile drape. We're going to place this on Chester's chest here. All right, and so now we're going to go ahead and take our prep, and we're going to clean the area, and we'll hold this up so this hand is not sterile anymore, and we're going to go ahead and clean in a circular motion, going from inner to outer. Okay, and then we can discard that. And next we're going to go ahead and grab our cotton tip and clean off any crust that might be around the catheter area, and we're going to go ahead and discard that as well. So next we're going to apply our skin prep and allow this to dry, and if we need to help dry it, we can grab our forceps and our gauze, and we can dry up the area. All right, and we can discard that as well. So next we're going to go ahead and grab our antimicrobial patch, and we're going to line that up and place that on over with the spongy side down. And now we're going to go ahead and grab our dressing, and we'll apply this over over the central line here. So we're going to make sure that we have this part down where it will be on the dress. It will be on the line there. Okay, so we have that secured in place, and then we can go ahead and take off the edges over here. Make sure that we're securing it along the way. Okay, so now we have that secured on there, and we have our piece of tape here that we can place on and put our initials and the date on there so that we know when to change it again. And then, oops, we have our tape on here that I forgot to take off. So we've labeled that, and then we're going to grab some tape, and we're going to secure the line to the patient's arm here. All right, and then we're going to make sure that we clean up our workspace area and throw away all of our trash. Remove our clothes, perform hand hygiene, and then we can take Chester's mask. We can raise the head of the bed up, make sure that he is comfortable, and then we're going to go ahead and document that we performed the blood draw, the time, the amount, the date, how the patient tolerated that, and then we're also going to document the assessment of the site, what it looked like. And then before we left the room, we measured to make sure that the length of the catheter was correct. And then we document that we changed the dressing, the time, the date that we changed it, how the patient tolerated it, how the site looked when we changed it, that the measurement that we took was correct, and that the line was patent when we flushed it. And so now we are going to check our healthcare provider orders, and we have an order for ceftriaxone 1 gram and convert IV to saline lock, and we're going to flush it with heparin since the client is being discharged. So we have our MAR and our healthcare provider orders. We have heparin IV flush 5 milliliters, and then we have ceftriaxone 1 gram every 8 hours, and it's 8 hours now, so we're going to go ahead and give that. So we are in our med room, and we're going to gather our supplies. We have our 2 saline flushes, which are 10 mils. And then we have our ceftriaxone 1 gram, and we have ceftriaxone 1 gram. Then we have our heparin 5 mils, heparin 5 milliliters, and we're going to verify this with another nurse. So we have our heparin 5 mils here. All right, and we can go ahead and bring this up to the patient's room. My glove, hi Chester, we're going to give you some meds. Can you tell me your first and last name, date of birth? Chester Chest, 7/19/19, Chester Chest, 7/19/19. Okay, so first we're going to go ahead and flush your line, and then we'll give you the ceftriaxone, and then we'll flush again, we'll give you heparin since you're being discharged, so that'll help prevent any blood clots, okay? Do you have any questions? No? All right, so perform hand hygiene, and then we're going to get on our gloves. All right, so we're going to go ahead and clean the hose here first. Our flushes are removed here. So we're going to go ahead and clean the hub for 10 to 15 seconds. So we have our saline flush. We're going to make sure that the line is patent before we give the medication. So we've attached that. We're going to unclamp, and we're going to go ahead and aspirate until we see blood in the line, but not in the syringe. Then we're going to use the push pause method to flush the line. Okay, and then we're going to clamp the line. And now we have our ceftriaxone 1 gram, ceftriaxone 1 gram. That matches up with our MAR for our med check, and we can go ahead and attach that. We'll unclamp the line here. And so then for this one, we're going to not use the push pause. We're going to push this med for 3 minutes. So we push on the med, and it's been 3 minutes, and the med has been given, so we're going to go ahead and clamp the line. Remove that. We can discard our syringes, and then we're going to go ahead and flush the line again to make sure that the patient gets all the medication. So we'll unclamp here. We're going to push pause method with this one. All right, and we'll clamp the line again. Okay, and so now we're going to go ahead and give our heparin. So we have heparin 5 mils, and we had this verified with our nurse before we left the med room. So for this, we're just going to attach a syringe, we'll unclamp the line, and we'll use the push pause for the heparin as well. And again, this is to help prevent any blood clots. We're going to clamp the line before I take that off, and then we're going to discard this into our Schweppes container. And we are going to make sure that Chester is comfortable. He's got his call light within reach. He has no questions, and then we're going to go ahead and document that we gave the medication, the time, the medication, the amount, the dosage, how well the patient tolerated it, and that is all. And that's it.